6.5 years ago, at age 31, I had my first abnormal pap, followed by a positive high-risk HPV test. At that time, I was pregnant with my second child, and not even a year later, I was diagnosed with cervical cancer, now 32 years old, with a 3-year-old daughter and a 3-month-old son. One thing that sticks with me the most from the day that I was diagnosed is the pure shock and disbelief in my doctor's voice that I had cervical cancer. If this can happen to you, it can happen to anybody, she said many, many times, and she still says it today when I do see her. You see, I wasn't the poster child for HPV or cervical cancer. I had always been on top of my health, receiving annual PAPs and exams for 13 consecutive years, and I was always told that everything was fine. I was in good health, normal weight, non-smoker, and the sexual history of both myself and my husband was just about as innocent as it gets. Then, suddenly, just 20 months later, after my last normal PAP, I had cervical cancer. This wasn't supposed to happen to me, but it did. I recently reached my 5-year cancer survivor milestone, and while a lot of my cancer story is in the past, my life has been changed in many ways because of it. And I can't help but wonder how my life would be different if HPV and cervical cancer weren't a part of my story and my history. I often think about how different my life would be today if I would have been screened earlier for HPV using the best tests possible. Maybe I wouldn't have to have a radical hysterectomy, chemotherapy, and radiation at age 32. I probably wouldn't have had to go through menopause more than 20 years before I was supposed to. Maybe it could have prevented my now permanent condition called lymphedema, which has hospitalized me 4 times in the last 5 years. Or maybe I wouldn't have to wear compression hose and compression shorts on a daily basis and receive bi-weekly therapy due to my compromised lymph system as a result of my hysterectomy. But in addition to all this, maybe, just maybe, I wouldn't have to live with the fear in the back of my head, the one that never goes away, the fear of dying as a young mother. There's nothing more terrifying to me than the thought of dying as a young mom and a young wife. And while my health is good now, and I have no reason to think otherwise, cancer has instilled this lifelong fear of reoccurrence. So today, I ask you to think, what if? What if today's decision helps my now 8-year-old daughter and all young women have the opportunity to be screened early using the best tests possible when they are older? I can tell you that this mom would be really happy because it would just be one more way that I can prevent her from having to go through what I did. If the decision made here today can help eradicate even one preventable cancer, think of how that would be life-changing for women like me who wonder, what if? Thank you.